In 1972, live births in England and Wales exceeded deaths by 211,000. The world population increased by 80 million during 1972. That is, England and Wales contributed the entire increase in the world population for one day of the year. Now, the World Health Organization estimates that each person requires 2.5 acres for the production of his food, the catchment and storage of fresh water, and the disposal of sewage. In England and Wales, we now have only 0.6 of an acre per person.
What really worries me is the quality of life. This is Liverpool, and I am the medical officer of health of this city, and I've been the medical officer of health for 20 years, so I think I know something about urban living. Now, Liverpool has always had a problem of too many people. Since ever the first medical officer was appointed, we've been struggling against overcrowding. And overcrowding is a problem that creates not only physical difficulties, but it creates moral difficulties. If a child can't have room to live in, then he tends to get bored, he tends to go out, run the streets, and all the time I'm trying to convince the people in Liverpool that family planning, that a balanced community, is what we want to aim at. We want to aim at a balanced community. Enough young people, enough working people, enough old people, and a great respect for all of us to be together and live together and help each other, but we cannot do this without some family planning program. And one of my main objectives has been to try to improve the overcrowding situation. And this is why, to some extent, the crime rate has been higher in Liverpool than we would like to see it. This is why the illegitimacy rate has been higher in Liverpool than we would like to see it. And we used to have the highest birth rate in the United Kingdom. I'm glad to say we don't have it now because we've moved a great many of our young people out to the new towns in the periphery, but we've only spread the problem. Particularly whenever we've moved people from one place to the other, they're disturbed. And we know this. And this is a time that very often more children are conceived. In an area like this that you see here, we've lost the coziness of the old town. And we realize that they're not as happy here sometimes, but you don't rehouse for this generation. You rehouse to help the next generation. And I think that we're doing this for these children that are going to be happy and they're going to live and enjoy life here. Now, we've got to get a balanced population in these new areas. 12 years ago, the local authority took over the family planning role, and now we offer family planning at clinics. We offer a family planning service in which people can be brought to family planning because we feel this is most important. What we find is that we need to take family planning to the woman because she's reluctant. This is a highly personal thing, and she's reluctant to come along to the clinic. So we have, for the past 10 years, operated a domiciliary family planning service in which we virtually visit the mother in her home. This domiciliary service is most important, and we do it everywhere, but above all, we need to do it in the older areas of Liverpool, where we meet most of our families who have problems.
I go to the door. I don't immediately on the doorstep say I'm the family planning sister. I just say that I'm from the hospital. When I get inside the house, I then, you know, when there are no neighbours to overhear, announce that I am the family planning sister. I discuss all the various methods, the pill, the cap, the coil, sterilisation of husband and wife. Don't tell her what she should have, but get the patient to decide which appeals to her. Now this may not be the best one in the long run, but it seems the best one to start off with. Having done that, I explain that she has her blood pressure taken, her weight watched, and she has cancer smears every year. If she doesn't come to the clinic, you know, they make very many promises, they don't always keep them, then I would pass her on to the domiciliary doctor, who can actually give pills in the home. That's the only thing the nurses can't do, is actually prescribe and give out pills. So then the domiciliary doctor would come and provide her, if necessary, coming every month, delivering a packet of pills.
Now, there's another important thing, and that is, should this be free? In my own opinion, it should be a free service. For 12 years, we've operated under the existing Family Planning Acts, but I think that it should be available, it should be free, because I am convinced, as a doctor, that anything is better than an unwanted child, and particularly an unwanted child born out of wedlock.
More than 156,000 pregnancies were legally terminated in England and Wales during 1972. In that year, there were approximately 750,000 live births. This means that approximately 20% of pregnancies were unplanned and, to a greater or less degree, unwanted. Now, I have done my fair share of terminations of pregnancy since the Abortion Act was introduced. But increasing experience convinces me that abortion is a rather messy and slightly dangerous way of applying contraception 3 months too late. I am convinced that the answer to the unplanned pregnancy is not more and more abortion, but more and more contraception. That is, prevention is better than curettage.
You may wonder why I'm here. Well, this is one of the last pieces of countryside left in Liverpool. And if we don't have a population policy in the city, sooner or later, and probably sooner, this will become a housing estate, just as many of our other open spaces have become. I'm convinced that a family planning program is an essential component of every community public health service, and that it is desirable not only from the point of view of creating a balanced population, but also for all the other benefits that it provides. The recent work in Aberdeen has shown that the benefit of family planning undoubtedly outweighs the cost of this service. This country is one of the most overcrowded in the world. If we don't do something about it, and fast, classrooms at the turn of the century may easily change from this to this. Getting on a bus now is bad enough. Imagine if an ordinary queue changed to this as a matter of course. With determination and the right methods, we can change this to this. But let me say finally that we can afford a family planning program. We cannot afford not to have it. Otherwise, we cannot leave all this to our children and grandchildren.
The Parliamentary Select Committee on Population recently estimated that an average family size of 2.1 children would stabilise the English population, whereas our average family size is 2.4, and the world average 3.5 children. Now, unfortunately, many doctors never think beyond the end of their scalpels, and they do not realise that it is their reduction in the death rate rather than the population at large's increase in the birth rate which has produced the current explosion in the population. We, the doctors, have produced this dragon, and now it is up to us to slay it. And just as we have had to learn that we must not take human life, so we must now realize that we must not thoughtlessly give human life.